My name is Jessica Johnson, and at 32, I thought I understood the rhythm of Harmony Medical Center. As the quality assurance coordinator for our 400-bed facility in Peaceful Valley, California, I'd spent 4 years learning every corner of this place, from the way morning light filtered through the atrium windows to the subtle hum of the ventilation system that lulled the night shift into routine. Harmony Medical prided itself on transparency. Our infection control rates were published quarterly, our patient satisfaction scores displayed prominently in the lobby, and our staff turnover remained enviably low. Dr. Harrison Martinez, our chief medical officer, often reminded us during monthly meetings that trust was our most valuable asset. Trust between colleagues, trust with patients, trust with the community that depended on us. But trust, I was beginning to learn, could be weaponized. It started with small inconsistencies in our catheter-associated urinary tract infection prevention reports. Numbers that didn't quite align with what I observed during my routine floor visits. Documentation that seemed too perfect, too consistent, especially coming from the evening shift in the medical surgical unit. Jennifer Rodriguez had been our covering nurse for 18 months, filling gaps across multiple departments with the kind of reliability that made administrators grateful and colleagues dependent. She'd trained half our newer staff on safety protocols, her voice carrying the authority of someone who'd seen it all. When she spoke about infection prevention during our monthly quality meetings, even the attending physicians listened. "The key is consistency," she'd say, her pen clicking rhythmically against her clipboard. "Every catheter insertion, every maintenance check, every documentation entry. No shortcuts, no exceptions." I'd nod along with everyone else, impressed by her dedication. Her reports were always submitted on time, her compliance rates consistently above benchmark. In a healthcare environment where cutting corners could mean the difference between life and death, Jennifer seemed like the gold standard. The first red flag appeared on a Tuesday morning in October. I was reviewing infection control data in my office when I noticed something odd in the Epic system. A catheter insertion documented at 11:47 p.m. showed perfect protocol compliance, every checkbox marked, every timestamp precise. But the patient's chart showed they'd been admitted to the emergency department at 11:52 p.m. that same night. 5 minutes. Jennifer had somehow documented a procedure 5 minutes before the patient had even arrived at the hospital. I stared at the screen, certain I'd made an error. I cross-referenced the medical record number, checked the date stamps twice, even called down to admissions to verify the timeline. Everything confirmed what I was seeing, documentation that defied the laws of time and space. My coffee grew cold as I dug deeper into the records. More inconsistencies emerged, subtle ones that would be easy to miss during routine audits. Catheter maintenance checks documented during shift changes when Jennifer was supposedly in mandatory training sessions. Infection prevention protocols marked complete for patients who'd been discharged hours earlier. The patterns were almost artistic in their precision, like someone had carefully crafted a narrative of perfect compliance, while reality told a different story entirely. I closed my laptop and walked to the window overlooking the staff parking lot. Jennifer's silver Honda was parked in its usual spot, 3 rows back from the main entrance. She'd be starting her shift soon, making her rounds with that same confident smile that had earned her the trust of doctors, administrators, and patients alike. But as I watched her walk through the automatic doors, badge swinging from her lanyard, something cold settled in my stomach. The woman I'd considered a model of professional excellence might be the architect of an elaborate deception, one that could compromise everything Harmony Medical Center stood for. The afternoon sun cast long shadows across my office floor as I opened my laptop again. Whatever I was about to uncover, there would be no going back. In a place where trust was supposed to be our greatest asset, I was about to discover how easily it could become our greatest vulnerability. The silence in my office felt heavy with possibility and dread. The next morning arrived with the familiar chaos of shift change. I positioned myself at the nurse's station earlier than usual, ostensibly reviewing quality metrics while actually observing Jennifer's routine. She moved through her pre-shift checklist with practiced efficiency, checking supply levels, reviewing patient assignments, updating the whiteboard with meticulous handwriting. "Morning, Jessica," she called out, flashing that warm smile that had always put me at ease. "Ready for another day of keeping us all compliant?" I managed a return smile, though it felt strained. Always. How was your weekend? Quiet. Caught up on some continuing education modules. She tapped her tablet. Actually finished that new catheter care protocol training you recommended. Fascinating updates on infection prevention strategies. The irony wasn't lost on me. Here she was, discussing the very protocol she might be falsifying, with the enthusiasm of someone genuinely committed to patient safety. Throughout the morning, I found myself creating reasons to be near the medical surgical unit. I reviewed hand hygiene compliance reports in the hallway, conducted impromptu equipment checks, and lingered during interdisciplinary rounds. Each time I observed Jennifer, she performed flawlessly, explaining procedures to patients, collaborating with physicians, mentoring newer staff with patience and expertise. Dr. Harrison Martinez, the unit's attending physician, stopped by my makeshift observation post around 10:30. Jessica, you're everywhere today. Special project? Just ensuring our quality initiatives are translating to bedside practice, I replied, which wasn't entirely untrue. Well, if you're looking for examples of excellence, Jennifer Garcia is your gold standard. I've never worked with a more thorough nurse. Her documentation is impeccable, her clinical judgment sound. We're lucky to have her. His words should have reassured me. Instead, they amplified my growing. How could someone so respected, so apparently dedicated, be involved in systematic falsification? That afternoon, I decided to dig deeper into the electronic health record system. Using my quality assurance access, I pulled catheter-associated infection data for the past 6 months. The numbers told a compelling story. Our unit had achieved remarkably low infection rates, consistently outperforming national benchmarks. But as I examined individual cases, the timeline discrepancies became more apparent. Jennifer's documentation showed perfect adherence to prevention protocols, yet the timestamps revealed impossible scenarios. Catheter care documented during her lunch breaks. Infection assessments completed while she was attending mandatory safety meetings in different buildings. I cross-referenced her badge access records with the documentation times. The pattern was undeniable. Jennifer was creating entries for procedures she couldn't possibly have performed when claimed. My hands trembled slightly as I printed This wasn't just poor record-keeping or innocent mistakes. This was deliberate, systematic falsification of critical safety documentation. The weight of discovery settled heavily on my shoulders. Jennifer wasn't just any nurse. She was our infection control champion, the person other staff looked to for guidance. She'd been responsible for training new hires on catheter care protocols, had presented at regional conferences on infection prevention, had even helped develop our current documentation standards. I thought about all the times she'd stayed late to help struggling colleagues, the way she'd advocated for patients when families had concerns, her genuine enthusiasm during our quality improvement meetings. How could someone so apparently committed to excellence be undermining the very systems designed to protect patients? Around 4 o'clock, I encountered Jennifer near the medication room. She was reviewing a patient chart with Catherine Rodriguez, one of our newer nurses. The key to preventing catheter-associated infections, Jennifer was explaining, is consistent, thorough documentation of every intervention. Even if it seems routine, that record-keeping creates accountability and helps us identify patterns before problems develop. Catherine nodded earnestly. I really appreciate you taking time to explain this. The documentation requirements seemed overwhelming at first. It's not about the paperwork, Jennifer continued. It's about proving we've done everything possible to keep our patients safe. When families trust us with their loved ones, we owe them that level of diligence. I stood frozen, listening to Jennifer articulate the exact principles she was violating. The sincerity in her voice, the passion for patient safety. It all seemed genuine. Yet the sign on my desk told a different story entirely. That evening, I stayed late to review more records. The pattern extended beyond just Jennifer's direct patient assignments. As the unit's infection control liaison, she had access to documentation from multiple nurses. Some of the falsified entries appeared to be covering for colleagues who might have missed required interventions. Was Jennifer trying to protect other staff from disciplinary action? Was she attempting to maintain the unit's stellar infection rates to avoid administrative scrutiny? Or was there something more calculated behind the deception? I found myself questioning everything I thought I knew about professional integrity. In healthcare, we operated on trust. Trust that colleagues would follow protocols, that documentation reflected reality, that everyone shared the same commitment to patient welfare. Jennifer's actions threatened the foundation of that trust. As I prepared to leave, I noticed Jennifer's car still in the parking lot. Through the window, I could see her in the break room, apparently finishing her shift notes. She looked tired, but content, the expression of someone who believed she'd done good work. The contradiction was almost unbearable. Here was a nurse who genuinely seemed to care about patients, who mentored colleagues with patience and skill, who had earned universal respect through years of dedicated service. Yet she was systematically falsifying critical safety documentation. I locked my office and walked to my car, the printed secure in my briefcase. Tomorrow, I would have to decide what to do with what I'd discovered. The easy path would be to approach Jennifer directly, to give her a chance to explain or correct the situation quietly. But this wasn't about protecting a colleague's reputation. This was about the integrity of our infection prevention program, about the trust patients placed in our care, about the credibility of every quality metric we reported to regulatory agencies. As I drove home through the quiet streets of Peaceful Valley, I realized that discovering the truth was only the beginning. The real challenge would be deciding how to on it, knowing that my choice would affect not just Jennifer, but the entire culture of trust we'd built at Harmony Medical Center. The weight of that responsibility felt heavier than any clinical decision I'd ever faced. The next morning arrived with the kind of crisp clarity that made difficult decisions feel inevitable. I arrived at Harmony Medical Center an hour early, needing time to organize my thoughts before the confrontation that could no longer be avoided. My first stop was Dr. Harrison Martinez's office. As Chief Medical Officer, he would need to be informed before I took any formal action. I found him reviewing surgical schedules, his usual morning routine accompanied by what appeared to be his fourth cup of coffee. "Jessica, you're here early," he said, glancing up from his computer screen. "Everything all right?" I closed his office door and took the seat across from his desk. "We need to discuss a serious issue with our infection prevention documentation." His expression shifted immediately from casual concern to focused attention. In my 3 years working with Dr. Martinez, I'd learned to appreciate his direct approach to problems. He listened without interruption as I presented the I'd compiled, watching his face grow increasingly grave. "You're certain about these discrepancies?" he asked, reviewing the printed documentation. "I've verified the data multiple times. The falsification appears systematic, not accidental." Dr. Martinez leaned back in his chair, processing the implications. "Jennifer Garcia has been with us for 12 years. Her reputation is impeccable." "Which makes this situation more concerning, not less," I replied. "If someone of her standing is willing to falsify documentation, we need to understand why and ensure it hasn't spread to other areas." He nodded slowly. "What's your recommendation?" "We need to conduct a formal investigation through risk management and notify our compliance officer. This affects our regulatory reporting and, potentially, our accreditation status." "Agreed. I'll contact Amanda Thompson in risk management immediately. In the meantime, I need you to secure all relevant documentation and prepare a comprehensive report." As I left his office, I felt a mixture of relief and apprehension. The wheels were now in motion, but I knew the coming days would test every professional relationship I'd built at Harmony Medical Center. My next challenge came sooner than expected. Jennifer was scheduled to work the day shift, and I would need to interact with her normally while the investigation proceeded. The thought of maintaining professional courtesy while harboring such serious concerns felt almost impossible. I found her in the medication room, preparing for morning rounds. She looked up with her usual warm smile, completely unaware that her world was about to change dramatically. "Morning, Jessica. I wanted to thank you again for covering that training session last week. The staff really appreciated your presentation on the new documentation requirements." The irony of her comment was almost painful. "Of course. How are things going with the CAUTI prevention protocols?" "Excellent, actually. We've maintained our zero infection rate for 6 months now. The staff has really embraced the enhanced monitoring procedures." I watched her face carefully, searching for any sign of deception or discomfort. There was none. Jennifer appeared genuinely proud of the unit's performance, seemingly unaware that her falsified documentation was the foundation of those impressive statistics. "That's remarkable consistency," I said carefully. "The documentation has been thorough." "Well, you know how seriously we take compliance here. Every catheter insertion, every maintenance check, every removal, it's all documented according to protocol." Her confidence was unsettling. Either Jennifer was an exceptionally skilled deceiver, or she had somehow rationalized her actions to the point where she genuinely believed she was maintaining standards rather than undermining them. The morning progressed with agonizing normalcy. I attended the daily safety huddle, reviewed quality metrics, and participated in routine administrative meetings, all while knowing that a formal investigation was beginning behind the scenes. Around noon, I received a call from Amanda Thompson requesting an immediate meeting. I found her in the risk management office, accompanied by Catherine Williams, our compliance officer, and Dr. Martinez. "We've begun a preliminary review of the documentation you provided," Amanda said without preamble. "The patterns you identified are consistent with systematic falsification. We need to expand the investigation to determine the full scope," Catherine leaned. "This could affect our upcoming Joint Commission survey. If these discrepancies are discovered during their review, we're looking at potential sanctions and public reporting requirements." "What's the timeline for resolution?" I asked. "We need to complete the investigation within 2 weeks," Dr. Martinez replied. "That means interviewing staff, reviewing additional documentation, and determining appropriate disciplinary action." Amanda opened a thick folder. "We'll need your continued cooperation in identifying specific instances of falsification. Can you work with our team to create a comprehensive timeline?" I agreed, knowing that the next 2 weeks would require me to essentially build a case against a colleague I had respected and trusted. The weight of that responsibility felt heavier with each passing hour. The investigation proceeded with clinical efficiency. Amanda's team reviewed months of documentation, interviewed staff members, and cross-referenced electronic records with paper documentation. I found myself working closely with Dr. Harrison Rodriguez from Internal Medicine, who had been assigned to provide clinical oversight for the investigation. "The pattern is clear," Dr. Rodriguez said during one of our review sessions. "The falsified entries consistently occur during Jennifer's shifts, and they always show perfect compliance with protocols." "What troubles me most is the sophistication," I replied. "These aren't random errors or shortcuts. Someone with deep knowledge of our systems created these false entries." As the investigation progressed, I began to notice changes in the hospital's atmosphere. Word of the inquiry had somehow leaked, despite our efforts at discretion. Staff members seemed more cautious in their interactions, and I caught several colleagues watching me with expressions I couldn't quite interpret. The most difficult moment came when Jennifer approached me directly. It was late afternoon, and I was reviewing documentation in my office when she knocked on my door. "Jessica, can we talk?" she asked, her usual confidence replaced by obvious concern. I gestured to the chair across from my desk, my heart racing. "Of course. What's on your mind?" "There are rumors about some kind of investigation involving our unit. People are saying there might be problems with our infection prevention documentation." I maintained eye contact, choosing my words carefully. "I can't discuss ongoing administrative matters, but I can assure you that any investigation would be conducted fairly and thoroughly." Jennifer's expression shifted, and for the first time, I saw something that might have been fear in her eyes. "Jessica, if there are concerns about documentation, I want you to know that I've always tried to maintain the highest standards. Sometimes the electronic system can be confusing, and maybe there have been input errors, but never anything intentional." The careful phrasing of her response was telling. She was already preparing a defense based on technical errors rather than systematic falsification. "I understand," I replied. "If there are any questions about your documentation, I'm sure you'll have the opportunity to address them through proper channels." After she left, I sat in my office feeling the full weight of the situation. Jennifer's visit confirmed that she was aware of the investigation, and her defensive posture suggested she understood the seriousness of the allegations. The breakthrough came during the second week of the investigation. Amanda's team discovered that Jennifer had been accessing the electronic documentation system from home, making entries hours after her shifts had ended. The timestamps revealed a pattern of retroactive documentation that coincided perfectly with the falsified entries I had identified. "This changes everything," Catherine Williams said during our final review meeting. "We're no longer looking at documentation errors or system confusion. This is deliberate manipulation of medical records." Dr. Martinez nodded grimly. "We need to move to formal disciplinary action immediately. The pest is overwhelming." The confrontation was scheduled for the following morning. Jennifer was called to a meeting with Human Resources, Risk Management, and Dr. Martinez. I was asked to attend as the investigating party, a role that felt both necessary and deeply uncomfortable. Jennifer entered the conference room with the same professional demeanor she had always maintained, but I could see the in her shoulders and the careful way she chose her seat. Amanda Thompson began the meeting by outlining the investigation's findings. As the was presented, the systematic falsification, the after-hours access, the pattern of deception, I watched Jennifer's composure gradually crumble. "These are serious allegations," Jennifer said, when given the opportunity to respond. "I want to be clear that everything I've done has been in the best interest of patient care and unit performance. Can you explain why you accessed the documentation system from home to make entries hours after your shifts ended?" Catherine asked. Jennifer was quiet for a long moment. When she finally spoke, her voice was barely above a whisper. "Sometimes I would remember things I had forgotten to document. I thought it was better to add the information late than to leave gaps in the record." "But the information you added was false," I said, speaking for the first time during the meeting. "These weren't forgotten details. These were fabricated compliance checks that never occurred." Jennifer looked directly at me, and I saw something collapse behind her eyes. "You don't understand the pressure we're under. The administration expects perfect infection rates. The staff works so hard, and sometimes they forget a step or miss a documentation requirement. I was protecting them." "By falsifying records?" Dr. Martinez asked. "By ensuring that our unit's performance reflected the quality of care we actually provide," Jennifer replied. "We do follow the protocols, maybe not every single time exactly as written, but the intent is there, the patients are safe." The room fell silent. Jennifer's admission was both a confession and a justification, revealing the complex motivations behind her actions while confirming the systematic nature of the deception. The meeting concluded with Jennifer's immediate suspension, pending final disciplinary action. As she gathered her belongings and surrendered her badge, she looked at me one final time. "I hope you understand that I never meant to betray anyone's trust," she said. "I was trying to protect something I believed in." I nodded, not trusting myself to speak. In that moment, I realized that Jennifer's betrayal was perhaps more tragic than malicious, a misguided attempt to preserve an image of excellence that had ultimately undermined the very standards she claimed to protect. As the conference room emptied, I remained behind with Dr. Martinez and Amanda Thompson to discuss the next steps. The investigation was complete, but the work of rebuilding trust and ensuring the integrity of our systems was just beginning.